compassion also means tolerance to me. Like their emotions could be really high. I feel like being compassionate is being tolerant of it.
Understanding that cultural differences and understanding those sensitivities makes a huge difference.
I cannot just dismiss your pain just because you don't have a necessary underlying condition.
The hope is to just bring in more of this conversation so that we can just pause and reflect. And once you start reflecting, everything's within us.
Now I think I'm less emotional. As I said, I have cultivated a practice where I have had a couple of patients who come from particular cultures where speaking about them brings ill luck. That's their thought. So you cannot break workshops like drills. And like we used to mock, she did something very good. Like she aced a test or something. My husband was, oh, gee, nobody would do this at this age. You did so amazing. And she shot back, said, Dad, everyone has their own talents. And we were shocked.
Hello, Dr. Vedha Srinivasan. Thank you for joining us today, and thank you for joining on the Hearts That Care show.
Thank you so much, Eva, for inviting me.
My pleasure. And for the next 1 hour, we would like to have conversations surrounding compassion in healthcare. We would like to understand your experiences surrounding the same, the wins, the challenges, with an intention to learn from you and also bring back compassion to the center of healthcare systems as we go forward. All right. To start off, can you tell us a little bit about yourself, your career, and how you got there?
Sure. Mine, I would say, is like a lots of twists and turns because so I did my med school in India, and then I started my residency. I did my residency in obstetrics and gynecology there. I was very, very intense of not moving from India. Like I wanted to stay closer to my parents. But then I met my husband who was already settled here. It's very interesting. He said, just come and try here for a year. We'll go back after I wrap my work, Like, so I was like, okay, so he's obviously an excellent person. So I made the decision to move here. And then like after a year, kind of reality hits and right, like, no, he's very entrenched here. He came here right after undergrad, did his master's here, his entire experience is here. So then I made a decision to get into residency here, go through the entire thing again. But this time I did try to do OB, but I guess like it was just like family reasons. I wanted to branch out into something else. And I did my rotations at Drexel, which was like really eye-opening in terms of medicine. And like, they were heavily focused on communication, patient-centered approach to medicine. That was an excellent program that Drexel was running. I think it's still there. So that's when I like, okay, medicine's kind of the basis of everything. So, and then I just like moved into this. So both life balance, I guess, work-life balance, but also like I was just really inspired with the type of medicine practiced here.
That's great. That's great to hear that. But in the first place, like, what led you to the field of medicine and healthcare itself?
So, in India, it's very different, right? Like you just jump from your high school to med school. Like there is like, you go there, you go through the process. Medicine is always something I was very interested in, to be honest. But when you come to final year, right in there, like you get inspired by like your professors, like your teachers, your mentors. And then I branched into OBGYN, like at the very last moment, I would say, in the last year of my med school kind of thing. When I came, as I said, I had good experience there, and I started out as doing OBGYN here as well. I did lots of research. I worked with some professors. I don't know what happened. I think it's just I got married and I was like pregnant with my first kid, right? Like I started thinking like in the broader sense, what I want to do, what would be sustainable for me in the future. And as I said, I was willing to branch out into something else from what I was doing. So I tried a few different things. I tried with like following with some family practitioners, like, and then internal medicine kind of thing. And as I said, I got into touch with really good mentors here who were internists. I think it's an IMG thing. All your mentors, most of your mentors, your college seniors, and everyone is in one particular field, and you just got attracted to it. And like, yeah, it seems like something that I could do. And then you just branch out. honestly, there's no one clear answer. It's just like series of decisions I made, I guess.
Got it. Got it. So, going to the heart of the show, the conversation surrounding compassion. When I say compassion, what comes to your mind?
It comes to my mind as really trying your best, like to be present for your patient. That I would say that kind of encompasses everything for me. Like, at that moment, focus on that one person, not as a disease, but, not just them, the family around them as well, right? Like, be present for them, like, actively listen to them, like, right? Like understand and try to explain, try to actively help. Be a little tolerant as well, I would say, because, they are the ones who are there with some kind of suffering or scared. They're worried. And I think compassion also means tolerance to me. Like their emotions could be really high. I feel like being compassionate is being tolerant of it, like understanding where they're coming from and then being engaged with them at that moment.
Got it. Got it. So I hear a little bit of listening, being present completely beyond the
Yeah, this is not just a checklist. Checklist. I did the medrec. I did this. This is not the checklist. Just be like, even if it takes 5 minutes, just be completely present with them and active listening. And as I said, just be present. I guess they will feel it.
Yes, yeah, yeah, that's great. So I think when we say, I think currently you're working as a hospitalist, correct? Can you explain a little bit about your day-to-day work looks like for us, please, as hospitalists?
Sure. Obviously, being a hospitalist, your day starts really early, right? You go in. The one good thing about where I work, obviously, I work with you, my friend Mar, like, is that you go in. There's like, okay, you see your colleagues, you see your team, and you feel good about it, right? And then, like, for me, it just goes just like see people, say hello, and then get back to my computer, just look at the list of patients that I need to see. And I usually go have a system of like, okay, I'm going to take a look at these patients that I had in mind, someone that's in step down, who's critical, who's sick. Like, let me just go through how they did through the night. Like, I think I spend like the first 1 hour, 1.5 hour just with myself and my charts and my thinking process. I would say, if there is no emergencies, just going through, seeing, formulating a plan. That's very interesting about medicine. You can look into the charts and come up and, like, with your thoughts, put everything together for each patient, saying that, hey, these are things I'm going to focus. I'm curious about this. I want to talk to the patient about this particular thing. And then, like, yeah. And then, like, obviously we work with amazing APPs as well. So touching base with them, with the patients that they are taking care of as well. So it's all done in that morning, I would say, in like 1 to 2 hours time when you go through the chart. Create a preliminary plan for the patients and a preliminary set of questions for me to go and ask them, especially if they are new admits overnight. I want to ask these questions. Like, is this something else that's happening with them? I create a plan, basically. And then obviously rounding, just going into the room, right? Like seeing each patient. That's when I think, like, I kind of tune everything out before I go to each patient room. And I just like, okay, this is what I saw. This is what I want to know from them. And this is what they would be worried. So I want to discuss, like, in the patient room, better part just goes in by starting by asking them what is their understanding, why they are in the hospital, what's happening to them, what sort of plan was discussed with them, and then walking them through, through the plans, examining and stuff like that. Yeah, so I would say that's how my morning goes. Yeah. Yeah. And then come back and do the rest of the work. But the main thing is that me formulating a plan or creating an idea and then seeing those real people and really discussing their own healthcare plans with them. I think that's the important part of the day.
And basically, how long have you been in practicing as an internal medicine physician?
It's going to be 2 years now after my residency. My first job is with Burma here. So it has been a couple of years now.
And how about in India? How
In India, I finished my residency and then I was practicing there for a year and a half, close to two.
got it? Have you noticed a huge difference between practicing in India and practicing here, and related to compassion and in general too?
Definitely, again, it's very, very individualistic, right? Like, I have seen excellent physicians there who like spend hours, like especially internists over there, right? They're like, it's cliche, but the old internists, like amazing bedside manner. So they do spend a lot of time at the bedside. So it's very individualized there as well. Like it's very person to person variability. But what from there to here, I would definitely say is that the patients, it's more both ways. Like it's like a collaboration with the patient as well. So the patient has a lot of autonomy. So you present options and then like kind of you work with them. I would say in India, it's also because the patients also think that, oh, the doctor knows the best in most part. So they leave most of the decision in your hands, right? Back in India. So it also goes in the other way that the doctors also sometimes there might come out as someone who's not collaborating but more patronizing. Oh, I'm saying this. This is what you need to do. Whereas here, I feel it's more collaborative.
So if we come back, I mean, you're talking about being the present and being listening, right? Over the course of your, I mean, since medical school to the OBGYN to your residency and to your current practice, has that changed over the course?
Of course.
How was it and how has it changed and what helped shape all that?
Your question, it changed a lot, right? So from med school to now, oh my God, I cannot believe that I've been like in this journey for so long, right? When you think about all your med school years until now, it definitely changes as you age, right? There is, I would say, until I came here and met with a few people, compassionate care or even like the art of communication is never taught in med school. So in med school, you're like a third person, like you're a different observer. You're just observing what's happening. You're not actively involved with the patient. So you do feel, oh my God, I feel so sad for this patient. That's that's a max you can do as a medical student, right? And then you go into residency, you're actively involved in patient care. So in med school, you're just like you're just like, oh my God, I feel so sad for this patient, but that's it. There's no more things that you can offer to the patient. When you become a resident, an early part of your career, I think you feel those emotions more intensely because you're directly involved in their care, right? So as I have matured into this current role, I feel like I'm less emotional, to be honest. Like I'm less emotional. Like earlier in my earlier days, if something happened, there is like an unexpected outcome. It used to really significantly affect me. But now I think I'm less emotional. As I said, I have cultivated a practice where I'm more understanding than emotional. And I'm like, okay, I'm going to do my best in this and I'm going to be there for them. So I think I have established a little bit of boundary and it just came with experience, not just taking care of patients. As you grow, your parents grow older, your family members grow older. You're on the other side of the healthcare at times, right? So it comes from that understanding. That's what I would say. Like right now, if there's people who label someone as a difficult patient or difficult family, because of my life experiences, like going through personal things in my own life, I can be on the other side, think for a minute, gather myself together and handle that situation. So yeah, I've changed tons.
If you don't mind us asking you, would you be able to share a little more about your personal experience that has actually shaped some of this care?
Yeah, of course. I don't want to do like too personal, but if it's for your own parent, right? My parent had gone through a major health challenge, and then being on the other side, and I was at that time like a young resident. I had just finished, right? So you know things, but you don't know fully, right? And you're there, like the smallest of the expression or the physical pain that you see in your parents is gonna set off a storm in yourself, right? And you might get angry, upset at the care team, but it's not just at them. It's just at the inability of you to solve that situation or take care of that situation. So I have done that. I have been there. I have been at times being cross with my mom like doctors. I've been like very impatient with them, but it was not a disrespect to them. It was just that I had no control over that situation. So, so I have gone through that. So not with one particular incident, like through my mom's health challenges, I have been like so lost and so unable to do stuff that I was angry and upset, not with just one particular person, just with the situation that was happening, right? So when I come across someone's family, right, right now, I can say, just detach myself, saying they're not angry at me. They're not showing they're upset at me. They're just upset at the situation.
Yeah, so true, right? I think that is so important to understand that when situations like this, like demanding or difficult situations arise, it's like so important to step back and think. Most of the times that we get very offended or defended and feel like we're being attacked, but it's like probably it's the fears or the concerns that they have beneath that's surfacing as different emotions. Yeah, that's so true and well said. Thank you for sharing that.
Yeah.
Those experiences.
Yeah, I cannot say that I'm like 100% perfect, but at least I try my best in those situations. I can look at the other side because of my personal experiences as well.
Got it. So yeah, I think yes, we're all on this journey and we all have lots of challenges in general, but what are some of the situations where you feel pressured and not being there? What are some of the barriers or the challenges that you face?
It's for everybody, right? It's the workload, right? Obviously. So that's, I would say, more than that. It's just that the time factor that it's like you do, like it's not just one thing. It's not just like, oh, talking to a patient and you try to be fully present for them, but just in general for anybody in healthcare, the amount of either patients they have to see, the numbers they have to meet, right? The like I guess like for us, it's like, oh, I have to finish this after this rounding is there. I have to tell who's gonna go home, right? I have to come back and to also finish my workday in a decent hour because I want to get back to my family, right? So I think that is one thing that's pressurizing in medicine. Thankfully, in hospital medicine, it's a bit different. When I hear my colleagues who are in like outpatient setup, like having much more distress because they do want to spend time with one particular patient, but the next one is waiting. It's just a 20-minute slot. At least I feel like in hospital medicine, there's a little bit of flexibility where I can choose to spend more time with a patient who's sick and their family than the other patient, which unfortunately not everyone has, especially in outpatient setup.
Got it. Got it. That's so true. That's so true. I think I feel outpatient practice is such a difficult thing to practice and much more challenging. And listening to more and more about the number of patients that they have to see and the time they have, like it feels more even more concerning to see how we can really take care of patients in 10 minutes.
Yes.
So much challenging. So are there any stories that stayed with you that made a huge impact on you and how you care has?
Yeah, I mean, it's a good question, right? But as I said, like, I've done so many roles now from med school, like residency here. There may be tons of stories. But if I had to think of a reason one, or the one where I focus more on like I understand that in hospital medicine, there's a little bit of palliative care involved as well. That's how I think, especially when you're working with critically ill patients. When I knew that I was talking to you, somehow I was thinking like, what about these things, compassion and stuff yesterday. And this was one patient who popped in my head. That was from my residency here at Downstate. It was the second wave of COVID, I think. So that was my intern year, almost the middle or end of intern year. It was like COVID is gone, but still a few patients getting sicker and being in ICU kind of stuff. And what there was one particular family, very involved kids in ICU. We knew that she's not going to make it. She's escalating like respiratory failure. She's going like, and we know that if she goes to intubation, it's very hard to extubate, like, just like over the clinical factors. And I knew that was the first time because it was also a little bit emotional. When the kids come, they would be so sad. They were worried that they were the ones who gave their mom COVID because they were not vaccinated and they were visiting her and they would be at the bedside every day, like kind of crying. So I used to spend some time like talking to them, like it's ICU. So it's not like really like pressurizing situation. You do have time for this entire shift to focus. So other than just looking at the mom and taking care of her, looking at her numbers, oh, she's on like BiPAP, what is happening? Like just like not numbers, but I spent some time talking to the family, the kids, and spending every day. I remember it was a very tough journey for her. And at the end, like she didn't make it. And unfortunately, I was the one who was there when she passed away. And I remember one of the daughters coming back and saying, like, thanking me for taking care of the mom, and also saying that they were very glad that she passed away when I was there. And I was like talking to them. That just like struck me so much. They lost their mom, but they took the time and they actually felt comfortable that I was taking care of her when she passed away. That made a huge mark on me. I was like, okay, that's when you see the patient not just as a patient, the family and everything together as a unit. You have to not address the patient. I felt like you have to involve the family and address them as well together. So yeah, that's one patient somehow popped in my mind yesterday when I was thinking about this and the impact that I had and that allowed me or kind of made me realize or paved the way that how much time I spend with the family right now with my patients when they have questions. I don't think I get flustered. I do spend time talking to the family, not just the patients as well.
Despite trying to do all this, sometimes have you had situations where there were much more challenging situations and it wasn't easy to get through the information that you wanted to across? And what were, I mean, any situations that like that which you think was very tough to handle or manage or be compassionate despite all the efforts that you put?
Lots of situations probably, right? So some of them, um, I could always come back the next day kind of mentality, right? Like, so, oh, okay, I did my best today. I did my best to communicate or get the message across to you today. And if there's a lot of resistance, just how we do, right? And like what, while you take care of really sick patients in the hospital, having those difficult conversations is not easy for the family the first day. So it's gonna be like, I broke it down into little bits this day. I'm gonna do it again tomorrow. So at least at this point, I'm at this point where I don't expect them to magically understand
Stand everything.
and be on board with me day one. And if I'm just like, if that's my expectation, I'm going to be super disappointed and frustrated and I'm going to be angry, upset at the family. So I'm like, okay, you're not going to agree to me the first day. So let's break it down. Okay, today let's look at these things. Tomorrow let's look at these things. Like there have been tons of difficult decisions for the families to make as well, where I just break it down, say, okay, let's focus on this today. We'll talk tomorrow. We'll assess every day. And then as it goes, let's make decisions. So allowing them some time to actually calm down and retrospectively look at stuff, I think that helps me because they're not going to accept what we say day one.
So, what are some of the common challenges, I mean, common situations or challenges that you come across and where you have to really break down and take it on multiple?
In our, like in hospital medicine, it obviously comes when there is the risk of doing certain things is actually harming the patient more than helping them, right? Like you see, like someone generally saying someone whose quality of life or very poor, there is nothing else that we can do, like end stage terminal malignancy diagnosis in a young patient is always very difficult, right? And it's also if there is also a little bit of cultural thing involved in it, right? So like there are certain cultures where they are not gonna easily decide about hospice, like like code status. They don't want to hear about those things because there are like here I have had a couple of patients who come from particular cultures where speaking about them brings ill luck. That's their thought. So you cannot break past that, right? So it's gonna take a lot of time. Like so I always find terminal cancer, nothing else can be done. Quality of life is nothing. They're in a lot of agony and trying to get the family to come to that point and decide what's best for them. Like that is a very difficult conversation in young people. And as I said, if there's cultural barriers as well, where they don't want to talk about those things, thinking that it's almost like they're giving up on their family members. That's the feeling they have. And I can totally understand. I come from a culture like that. So if they say that, okay, stop treatment, it means for them that they're giving up on their loved ones. Those are like the most challenging things I have seen.
That's so true. I mean, yes, I think especially with the young ones, it's much more younger patients. It's heart wrenching even for us, right?
Yes.
It's not going to be easy to have those discussions to deliver that. Yeah, she or he has to end the life. So I mean, the life is going to end for them soon, and they'll have small children. So it's such a tough time. And we, if we can feel so much how with somebody who has lived with them for most of their life? How can they
Yeah.
handle, right? It's
Yeah.
understanding that makes a huge difference. I've loved the approach that you've been taking in terms of like being present and being that at that moment, and understanding that my message and information will not get across on day one, and be prepared and be accepted. Understanding that cultural differences and understanding those sensitivities makes a huge difference, right? So that is you. But how, if we broaden this, how do you see this happening around you? And how frequently do we get frustrated? How can we handle those situations in general for the broader community of hospitalists or physicians? What are your
You're talking about, like, we can even talk about our, I would say, having a good support system, right, within amongst ourselves, and kind of like having what you do, right, like talk to different people, bringing it up, because if it is not spoken about, nobody's going to focus on it, right? Each one is going to be molded by their own experiences. As I said, it took me so long to be at this comfort level where I can have certain understanding, certain boundaries, and things that I can do. It came from lots of trial and error, by like with yourself, right? But I would say, in a broader community, just talking about these things, creating that awareness, makes people think for themselves. Otherwise, you're just so busy in your day-to-day life, you won't have a minute to think about or reflect upon these things. So just having someone talk about it, having a group, a community dealing with this as a community, I think is the only way you can like think about it and practice it more and more, because otherwise it will take probably a longer time, a longer journey, and like I don't know who else, like someone could be just suffering within themselves, but if someone speaks up, then it gets easier for everyone else to be supported as well.
That's right. Being a hospitalist, like, what do you see can be? I mean, how can you be supported by your leaders and support system to continue for those who are on this journey, right? You have reflected and gone to an understanding, but how can we, somebody who's like early on in their career, just fresh and have all these expectations that the patient should understand as the first moment we say? I mean, how can, in general, that is one aspect, but in general, even to a more advanced and more reflective, how can our leaders support us?
That's what I'm saying, like just support initiatives like you do, right? And kind of formalizing it and making it as a part of your, like, how you have like the year end, you have to do certain like modules to, this should be a part of it. I feel like it should be two things: arts of communication and this, both of it. I think like the best, both of them are super important, and they're skills that you can develop as years go, but also skills that could be taught. So if there are like groups and committees that focus on this, have some mindfulness, have time to reflect and talk with each other, it should be a part of the program itself. It should be a part of the culture. It should be part of an expectation that you meet certain times, like certain days. You spend like workshops, like my residency program, my experience at Drexel. There were like workshop days that are very, very dedicated, focusing on one particular thing and talking about it. I think that will help someone who just gets onto this career, and it should be a part of some med school kind of training, these things like the art of communication, like how you show compassion in healthcare, how you protect yourself. It should be a formalized education because it's something that could be practiced.
Yeah, that is another thing. I think a lot of us generally, at least whenever I come across, I've heard many people say it's like it's a trait you're born with, right? Compassion is a
No.
trait you're born with, but there is so much evidence out there. I know you did not do med school here back in India, but I don't remember having, I trained in India too, but I don't remember having any
Yeah.
specific discourses. But I think I was looking at the medical school curriculum, and it says demonstrate compassion and empathy.
Uh-huh.
Demonstrate compassion and empathy. That's what it said. But have we been teaching, right? I think definitely agree. I think we have to take this. I mean, we should go into the curriculum. And can you elaborate a little about the workshops that you're talking? Was it just purely medical workshops, or you're talking about?
No, it was amazing. So I did my residency at SUNY Downstate. Kings County was my primary. My associate program director at that time, Dr. Chang, was like very, very interested in art of communication and medicine. So for him, like it's just like a skill that you need to practice on. So that's where it comes from. I was like, it was eye-opening, right? We all know to talk, and we all know to express the medical things to somebody, but that's not real communication. So I still remember during our outpatient blocks, we used to have dedicated afternoons blocked out for these workshops where there'll be scenarios played out, like, difficult scenarios, like challenging clinical encounters, and we will be actively practicing how to deal with them, like how to structure. There was a structure to it, like the way we were taught, the way the workshops happen was like, if this is a patient who comes in and talks to you, they have been waiting there for 30 minutes, you're running, your clinic is late, your office. So how do you start? If they're angry at you, how do you? So there are drills that we practice. So as I said, we all know to speak, but to communicate effectively and actively listen and validate someone's emotions, it's a practice. So that we had like amazing like workshops, like drills, and like we used to do like mock acting. And I still remember we even had like sessions where you would run these skills, and they will actually like do a video recording of you, and we will go over it and say what we did good and what we could have improved in terms of how we communicate with our patients.
I love this. Yeah.
So it's an amazing program, and they were so passionate about this.
That is so, so important. I'm not sure how many programs do this. And I'm sure probably there are some communicational based programs in every program. But I think this seems to be a very effective, especially the recording and playing back.
Yes, playing back. It would be so embarrassing to see yourself in the encounter. But then, like, it would be nice for someone who's more experienced than us, right? Look at it and see how we did. Tell us, like, "Oh, you could have improved this." And as I said, it would be mock drills among residents. So I'll be the patient for my co-resident. And as we like your practice, you might not be able to implement all the 100 steps that we go through, but slowly you'll start catching up here and there and implementing in your communication with the patients.
That's awesome. It's awesome. Uh, if we so were there other tips and tricks from your residency, or
There might be tons, right? The other good thing is that, like, I do even now when we used to go to patients' rooms, right? Like even on the inpatient block, the suggestion was that to sit and not stand and talk. Right. So I use it even now when someone is like really sick, or someone who has like, it takes a lot of time. It's also patient dependent, right? Some of them are like, I'm good. I know everything. I'm on go. Right. So you just breathe in, breathe out. There are some patients you need to break it down because they're very complex. I still sit. And there are lots of my program, like director will show lots of studies where the patients, even if you spend the same amount of time standing and sitting, if you sit and spend the same amount, the patient felt that you were more present.
that's so
Spend more time with them. So that's also one of the curious things that we practiced.
That's awesome. That's great. Yeah. So it's all wonderful. That's great. So if we tell us a little bit about your experiences surrounding, I think we have situations with a lot of drug dependence, unfortunately, and chronic pain situations. And how do you manage these patients, and how are you able to meet them where they are?
It is one of the most challenging, right? So as I said, now I have kind of developed my own routine, like making hard decisions for those young, really terminally ill patients. I have a routine of like, how can I go through this, right? Like, how can I do? Like, unfortunately, substance abuse and drug abuse, like these patients, I still struggle, to be honest, right? So I still struggle. But I'm like, the only thing I always tell them is like, hey, it's a very subjective, complex symptom. So I cannot dismiss your pain. I cannot just dismiss your pain just because you don't have a necessary underlying condition, which I think is triggering you the pain signals, right? So I'm like, it's a very complex. So I really try my best to work with them, right? Like come to an understanding. Again, it's very challenging, right? Someone is going to require like, I want a lot at Q2 with Benadryl, Q1, right? So there are certain patients like where I just say, okay, for the first 24 hours, this is what we are going to do. In the next 24 hours, we are going to work up these things. And if they are negative, let's try this. There is like different things. So I would say this is one of the most challenging things to do because, again, it's a very subjective sensation. You cannot dismiss someone else's pain symptom, though it is one of those changes where I do agree to certain plans from what the patient says and then like slowly work my way to creating a regimen and like having a structure to it, like having also what really helps me is like discussing with them the plans of like how to wean it down with the goal of painting and getting them outside. Like I have had patients who are like real pain, like pancreatitis, like pretty bad ascites because of pancreatitis. Like it's horrible inflammation there. And they are on this for 5 days. Even the patient would get super anxious about how am I going to go home and not have these IV pain medications, right? It's a very legitimate question. I cannot dismiss it because it's not my inflammation and I don't know how they're feeling. So planning it ahead with them kind of sometimes helps me. I'm like, okay, let's do these for like 3 days. Let's break it down. Let's like kind of reduce the frequency, put on an add-on medicine. Let's see, we'll switch you to PO medications from tomorrow. Let's see, I'll still keep a breakthrough medication there for 24 hours and then slowly wean you off. So just working with them ahead, I think is better. That's why I felt it's easier, even if we don't go progress according to what I plan or we discuss. I always feel at the end, you can come to a balance.
Better balance.
Yeah, just like planning.
And how about these? How do you handle the metrics, the length of stay, the readmissions? How do you, I mean, does it put a lot of pressure?
I think I'm too naive. Not like I've not been in the system or a part of this for so long to have had positive or negative experiences with it, right? So it's just 2 years. So I haven't had any negative experiences with it. So I don't think too much about it. Like, oh, I get an email about length of stay. I'm just writing back why the patient is not there. So I'm not like, I don't think I'm necessarily pressurized if I see my name on length of stay, because there's going to be obvious reason why the patient is there. Either it's social or like medical or still they are sick. There is something. It's not that I just want them to be in the hospital. If someone is able to jump in and help me with it, great. But at least, as I said, in my limited experience, I've not been pressurized with it. Readmission, I have had like one or two in the beginning of the year. Then it does put a pressure in a different way. You feel like, oh my God, did I miss something? Did I send them too early? Or are these patients prone to come back again and again? Like, or that is something I'll put a pressure on myself. Like, look at it. See, did I miss some cues that they were developing here that brought back into the hospital versus they are chronically sick? I could not have done anything else. So that is one thing I look at. Definitely not length of stay or anything.
Have you had situations or any stories where, I know, being this part, right? Like just sitting in there and explaining and talking to the family made the difference in the outcome compared to what it would have been otherwise. I'm again probably I'm sensing that you didn't have many situations where you are like just going bed to bed, but anything that stands out beyond that initial story that we talked about in your residency, anything that
Even here, right? Like I remember last year, I work very closely with the palliative team here as well. They know me very well because I've had few situations where we had to spend days and days and days and talking. So the two patients I remember, that's where the barrier thing came, the cultural barrier thing came. There was a very young patient, like pancreatic cancer, like just mets everywhere. They were developing obstructive jaundice. We're not doing well. So the wife, they were from some parts of Africa where they don't want to talk about these things. And I know that for like a little bit because where downstate is also a lot of Caribbean population.
Mhm.
So I have had patients there as well talking about code status brings ill luck kind of situation. So I have had some experience working in a different area of the country. So here I had that patient because the wife wouldn't say anything, wouldn't express anything. It's not even talking to you back about like, no, I want everything to be done. She just wouldn't talk, right? So she'll come every day. She'll be at the husband's side every single day from morning to night. But when you go in and talk about certain plans or the lab numbers, how it's worsening or getting better, she won't just answer you. So she'll be just sitting at the bedside, right? So I still remember people getting a little bit frustrated, part of the care team, part of palliative, getting very frustrated with her. But it took really like few days for her to even open up and talk to me, right? Like, just communicate to me. And what really helped in that situation when we were talking, we understood that they do have a lot of family here. So the husband had a lot of brothers and sisters who were around close by. They were planning to buy a house, go to Africa this vacation, knowing a little bit here and there about them kind of helped involve the brothers and sisters more. And they started coming to the bedside every day, supporting her through this process. And until they basically handheld her, walked her through making him like changing his code status and making him hospice. It was like more family involvement, right? So in some cultures, the extended family is not that involved. Understanding that here the family would play a huge part helped us to be like calling them, asking them to be a part of family meeting. And the wife would not talk to us, but she would break down to them, right? So she'll cry on their shoulders. And them supporting them helped her make those decisions, which ultimately I really felt bad for the patient and wanted him to be comfortable. He was in so much agony and nothing else we were doing for him, unfortunately. So just understanding that her family would be a much critical support system for her. Like the brother, I still remember, said that like openly that I'll take care of the children. You don't worry, we are there. Right. And this poor woman broke down with them. And I still remember talking more to the extended family members than her, so I think that is one example I could say that comes to my mind, really young patient. Yeah.
I'm just curious, what was the average age of this patient?
I think he was just 45, very young, 45, 46. And I think he was someone who was in our system working in one of the acute rehabs kind of stuff. And they had tons of plans for themselves. They were planning to buy a home, go on vacation to their home country. And then just like boom, everything just collapsed for her.
Right.
Yeah.
Life just changes.
Yeah, so that was brutal. And it was really challenging because, as I said, she would not speak. She would not utter more than 3 words the whole day to any of the team members going in. So that was like really challenging and really, really heartbreaking patient.
I mean, it's such a tough. She probably had dreamt a whole different life.
I know, right? I know. You cannot believe that. It's just like, and when you look at the small kid, like you're a physician, okay, yes, but you're a wife and you're a mother, right? And you look at that family and like the small kid, and you just get a gut punch, right? Like it's such a horrible situation to be in, and sometimes it happens, like when you accidentally think, oh, what if it was me? Right? Because you panic and you worry. You think of your kids as well when you see that little kid. So yeah, that was like a very, very sad situation.
Going back, I just wanted to see, I think your experiences in healthcare, right? And I see that how it changed and just reaching out, taking care and understanding your patients and the families, right? Has these experiences, how have they translated into your life, learnings for your life?
In my life, I'll be really honest, I'm that kind of person who leaves work at work kind of person. But to do that, this has helped, right? When I'm there, I put my best, okay? When I'm there, I'm present. I want to talk to the patient. I'm not frustrated at you. I'm not angry at a family, not understanding that their 101-year-old mom doesn't need a peg. I'm not going to get frustrated. It's your mom. You're making those tough decisions. So having that understanding has allowed me to leave work at work. So when I come back home, I don't carry much emotions from work. So when I'm back home, yes, I might be tired. Yes, I don't want to make dinner, but when I come back home, I'm coming back home happier to focus on my kids and my husband. You know what I mean? So I think just having that boundaries and that mindset at work, that everyone is making their own tough decisions and they're actively trying to help them make those decisions. And that kind of have like de-stressed me at home.
But these learnings have you implemented into your life, and did it make
And then and more understanding at home. No, I don't think so. To be honest, I think I'm like much better in understanding and like being more. I'm not in that situation yet. Like that's like right. Like maybe as we grow older in life as well, in personal life, you will become that way. But I think I'm much more calmer, understanding, and much more less egoistic at work than home. So I'll be honest there. I think I'm very less egoistic, as I said, more understanding at work. At home, I could still be like a bit egoistic.
All right, so you'll probably many more years to go.
I know. Probably it takes many more years to reach that level of balance at home in our relationship.
Yeah.
I'm probably talking about like Vimal. I have,
No,
but with your spouse having that kind of understanding and being that patient and stuff, no, it's gonna take years.
that's so true. So I think the next few aspects, I think I want to do, I mean, we would like to go through rapid fire questions.
Oh wow.
5 questions, 1 word answers as much as you can.
Okay, I'll
And we'll
try.
continue a little bit after that. So when I say compassion, what comes to your mind?
Tolerance.
Right. And when I say self-compassion,
It's just basis of happiness.
when I say healing,
Healing? Healing?
healing.
No, it's a very personal experience, I guess. Everyone has to work on it.
Oh, wow. Okay, that's wonderful. Yeah. A book or a person or something that stood with you or inspired you for the person you are today.
My mom.
And if there's what's one thing that you do every single day? Don't say brushing your teeth, but or taking a shower, but one thing that you do for being this person you are and being that understanding person in the healthcare systems.
Talking to my kids, honestly. They have much more emotional intelligence than me at this age.
Wow, I love
Yeah,
to
they have
hear.
great EQ.
I would love to hear that. Yeah, those were my first 5 questions. I want to hear a little bit about mom and a little bit about the conversations with kids.
Yeah,
The
oh my
EQ
God.
aspect.
I know, right? So my kids are amazing. Like we do speak about certain patients or stuff, right? Sometimes it's very stunning. Like just in general, right? Like when we say like my kid, like my first kid, you have met her, like I remember when she was just 3.5 or 4, did something very good. Like she aced a test or something. My husband was, gee, nobody would do this at this age. You did so amazing. And she shocked back, said, Dad, everyone has their own talents. And we were shocked. And I was just laughing. I was telling my husband, you cannot motivate these kids by comparing with them others, right? So they are, they have that, like, I'm amazed by my kids. Like sometimes I talk about patients, like they were like, I will be like, oh my God, this patient's mom was very mean to the nurse or something, right? Just like, and my kids would be like, no, maybe they were scared. Like the way they say, sometimes I love talking to them about my work,
That is
They're
so
like, they're just like very small. They're like 8 and 6, but right. But when it comes to, it's just the kids' perspective. It's like sometimes they can say striking things. So they'll be like, they were not mean. They were just very scared. Well, like, so it's just like brings back a lot of perspective. I love talking to them. I feel very happy that these kids like are, maybe it's just their schooling. I don't know if it's from school, right? Like they have like an in-depth understanding about themselves, feelings. They talk about feelings. They are much more vocal in naming their feelings and stuff. So I do feel like the younger generation have more emotional in-depth like intelligence than we were at their age.
It's awesome. And tell
Yeah.
us a little bit more about mom as well.
My mom was like, oh my God, she was the gentlest person. Everyone knows that. Like everyone loves their mom. Like,
Yeah.
like right, like there was nobody called us a bad mom, right? So, but what really stood out with my mom, like when I see not as a mom but as a person, when I just put her aside and look at her, is that her kindness.
Mhm.
Right? Very, very kind person. And she really, really wanted, she was a professor. She was so interested and she would like to help someone read, like learn, right? So that was like that showed through everything. Like, and the other thing is like never compared us with anybody and never compared anyone based on her standard for someone or her judgment or something about was how good they are rather than how they look, how they dress, like, how rich they are. Never had those conversations as a kid at home. And I will be like, thinking back now, I'm like, okay, lots of things like that she molded us without even saying or calling out them. Like she never spoke of ill of anyone. She never compared anyone. She never spoke ill of somebody just because they were unfortunate in certain situations, right? She spoke highly of people who really worked hard, were trying to push boundaries. So without you realizing, you also try to look people in that direction, in that way.
Yeah, that's so true. I mean, you're basically in that environment all the time, and that's how we
Exactly.
start thinking and get molded all along as.
Exactly. Without you realizing how you judge people or how you treat people, without you realizing that's the standard that's set in your home. And like now as an adult, when I look back, I sometimes get emotional thinking about my mom. Oh, she was never loud. She was never preachy. She didn't teach us these things by talking to us about these things. It was just the environment around us. She set up our home that way, and we just grew in it without us realizing those things.
So beautiful. I have to talk to mom about, or you about being preachy, but because I think sometimes I come across like that.
Oh, no. Oh, I do that too. Right? I forgot to say, I lost my mom in 2018. She's no more. So yeah, so she was like, that's what I'm saying. Like I'm able to now just move away or think her as a person, not just as a mom, and look at some of the traits that has molded us now, without having to think of, oh, that's my mom. Having those emotions, I can just think about her as a person and say that, oh my God, these things I didn't realize. It was inculcated in us young without us realizing it. Sometimes I'm very preachy to my kids. So, so sometimes I read myself back and I tell even my husband that, you know what, let's just set example by acting. Let's not just tell them to do stuff.
Yeah, that is so powerful. I think that is what I've learned when I wanted to. I think for my older one, I started reflecting
Yeah.
and started looking at how I'm doing my job at work. And I think, I mean, that was probably around 8 years ago. How am I performing my job? How am I approaching? So I think that's because I wanted to be a role model rather than just tell them.
Exactly.
So,
I do still tell them, but then after some time, I'm like, no, I should rather, because as I said, these kids are very intelligent. The kids now are very intelligent, very smart, very, very good kids. So I'm like, okay, let's not just preach them. Let's set examples so they don't just follow, or like sometimes they are even better than us in a lot of stuff. So
so much.
yeah.
Um, yeah. So as we are coming to the close, there are a couple more questions I would like to ask. But before that, are there any specific topics or anything specific that you want to bring up and talk?
No, I just wanted to take a moment to say how much I mean, I just say when I meet you on the way that, oh, you're doing amazing. But I just want to let you know, as I said, I'm very passionate about these things, right? Like I'm passionate about communication, like support system, like, having this as a broader community, how we develop this. Am, I'm very passionate and I'm so happy and so proud of you for bringing this up, like talking about this, getting this into our culture, and at least raising awareness, like making people turn around and say, hey, what are you doing, what is this about? Like sometimes we just get caught up so much in our day-to-day activity, we forget all these things. So I'm just so happy and so proud of you for doing this. And I hope more and more people are involved and this becomes more a structured thing that we do often. Side work.
That means a lot. And thank you so much, Vedha. But you're so true. I think one of the key points that I've been believing is like we're all in this because we care for people. It's just that this autopilot mode and we are this on this constant go thing, and we don't sometimes pause and reflect to see how beautiful work we do, right? And get lost into the logistics of just getting the work done. So I think the hope is to just bring in more of this conversation so that we can just pause and reflect. And once you start reflecting, everything's within us. Right?
Yes.
Probably yes, we can give a little structure, definitely, to show how we can demonstrate compassion and empathy and not just say demonstrate compassion and empathy.
Yeah. I mean, even what you're doing, right? Like you're asking me the questions, I'm thinking, I'm talking, and I'm listening to other people talking. It doesn't even need to be like a structured thing. Just talking, you can pick up certain threads from people.
Yeah.
And I guess at this stage for us, like being really busy, even if it's not a very structured one, just having the time to talk to each other about one particular, like it could be as simple as, hey, what was the most challenging patient encounter you had this entire week?
Mhm.
And
Reflective sessions.
just reflective sessions with each other talking. I think we could do a lot of passive learning from that as well.
I think that's the next thing probably after we can start after celebrating, right?
Yeah.
Celebrating. We've been celebrating each other, but probably something that we can start. That'll be awesome.
Yeah.
Yeah, the demonstrating part, probably they're looking at the medical education part.
Yes.
From the medical education standpoint, I think right now. So what is one thing that you would suggest our listeners to do after they finish listening to this? One suggestion that they can start doing today.
So one thing I feel like, be very kind to yourself, right? You're doing the best you can there. So just being mindful of that I'm trying my best, I'm doing my best. If it is not today, it's going to be tomorrow, right? So like, there is a medicine part where you need to just act quickly, stabilize a patient and all those things. But the most difficulty or frustration comes with challenging family conversations, like decision making and like all those stuff, palliative involvement in those things. I would like to remind my friends that just be kind to yourself, focus on what you can do today, what you can't do, have that boundaries, and you can always come back to the same thing again tomorrow, not just get frustrated with it and just build on it. Like I think that will save your energy for the next day.
It's awesome. That's an awesome advice. Thank you so much, Vedha. And any other parting messages for our audience?
That's what I would say. I just love everybody I'm working with currently. And I do feel like we have a little bit of like space where we just say, oh my God, I had a very tough encounter today. I just wish that we had more time, intention in actually talking to them about it, right? Like, like listening to them about it and like supporting each other. Yes.
Yeah. Thank you so much for joining us. And it was great pleasure to listen to you. And I think right at the get-go, like how present you are with your patients and listening and being tolerant. Thank you so much. And thank you for sharing all the stories.
Well, I'm not 100% there, but like it's a work in progress for I guess.
Believe me, I think nobody on this earth is 100% yet. And
Yeah.
if that's the case, we wouldn't be here. And
Exactly.
we're all just working in work in progress. And I think that's what. And sometimes some of us forget. Hopefully not, but I think consciously trying to put that in practice makes a huge difference and makes it easier for us to grow and evolve.
Exactly. Yeah.
But sometimes we want to be in that status quo mode, and
I know, right? There are days when you're like, okay, I'm done with this. But then like you pull yourself the next day again with the same understanding, being kind to yourself and saying that this is what I could do today. Let me reserve my energy and I can come back tomorrow and address this. I think, yeah, it's a work in progress again.
thank you so much.
Yeah. Thank you for inviting me. Okay. Hope to hear more from you.